Hello everyone, welcome to 2050 Healthcare. Today we have with us Dr. Bikash Ranjan Behera from Some Ultimate. He is acting as a senior neurosurgeon and today he is with us to discuss on a very important topic, that is brain tumor. Welcome sir.
Thank you. Thank you.
Sir, firstly I would like to know from you, what exactly is a brain tumor?
A brain tumor basically is, it's not about brain tumor. Any tumor is same. Basically, it's abnormal like proliferation of any human cell that will cause a lump or a mass inside any part of our body is known as a tumor. See, when it happens inside the brain, we call it as a brain tumor. It's nothing different from any other part of the body. It's same, but it's inside the brain. It is an abnormal mass of tissue, abnormal proliferative mass of or a lump inside the brain. Basically, we call it as a brain tumor.
Okay. Sir, is there any exact reason for having a brain tumor or like?
See, brain tumor, if we see maximum case, we don't know the reason. But yes, in some cases, we can think of genetics. Like neurofibromatosis is a condition where this is a familial disease where the tumor can the progenies or the children can carry the tumor from the parents. Some cases like that, but most of the cases is that the cause is not known. But few cases radiation is brain radiation is one of the cause of a brain tumor. Another thing is a few mutations. Sometimes few mutations we have seen can cause a brain tumor. But most of the brain tumor, as far as we know, as far as the science has developed till now, we know that there is no typical cause. We cannot ascertain that who is going to have a brain tumor. We cannot tell it definitely. Anyone can have it.
Okay. Sir, as you just said, it can be genetic majorly. So, are there any specific, uh, like, set of people who are more prone to having a tumor, like maybe a specific category of age group or who are at a higher risk?
See, as far as the age is concerned, yes, there are in brain tumors we can categorize age-wise also. Few brain tumors are there, which most commonly seen in elderly groups, and most of them are mostly cancerous tumors, like malignant tumors, and also few tumors we see in the pediatric age group. And in pediatric age group, brain tumor is one of the commonest cause of any kind of malignancy. So these are also mostly like cancerous tumors. But nowadays we see that the young generation is also suffering from tumors. So age wise, yes, elderly and pediatrics age group, few brain tumors are we can see in these age groups, but commonly we can nowadays find any in any age group you can find brain tumors. And apart from age, if we see any person having any other tumors, like in females breast cancer, if we talk about breast cancer, is one of the most important cause of a secondary brain tumor. See, brain tumor can be a primary brain tumor or a secondary brain tumor. Is a primary brain tumor is a brain tumor itself, it originates from the brain inside. But in secondary brain tumors is mostly metastatic tumors where any other tumor from any other part of the body that metastasizes to the brain and act as a brain tumor. So those are the cases. Suppose that we can tell, yes, if it's a case of lung cancer, thyroid cancer and breast cancer, they are very much predominantly they can carry this brain tumors in after a few years of these tumors. Another thing, as I told before, like radiation is one of the causative agent of factor for brain tumor. Then that, like mutations, genetics, they're all there.
So, are most of the tumors cancerous?
No, most of the tumors are basically benign. Few of the tumors are like cancerous. If we see most common tumors, what we find in middle age group is a meningiomas and schwannomas. They are benign tumors, benign lumps. But few tumors like glioblastomas, medulloblastomas, like glioblastomas, they most commonly seen in elderly age group. Medulloblastomas are young and pediatric age groups. These are like malignant tumors. So yes, malignant tumor are common, and also benign tumors are common. Not all the brain tumors are like malignant. Most of them are benign, but yes, few of them are cancerous also.
On a brief scale, like what are basically the symptoms of brain tumor that mostly we should not ignore?
Yes, important thing. See, the most, and if we want to know the single most important thing, it's headache, and mostly the early morning headache, new onset headache associated with like vomiting, visual blurring, and seizure or fits, and some kind of weakness or focal neurological deficits. These are one of the most important signs of person carrying a brain tumor. So these are our like red flags. If you find some kind of headache in a person which is recent onset and having these symptoms, we advise him to get it properly examined by a neurosurgeon and properly scanned.
So headaches, as we all know, is like very common,
Very
right?
common.
So how can we differentiate like
Yes.
this kind of headaches?
Headache, yes. Actually, if we see, it's less than 1% or maybe less than 0.5% of headache can be caused by brain tumors. So it's very like less likely all kind of headache can be this kind of brain tumor. But yes, few important findings we must remember, that one is the early onset and a new or new onset, then early morning headache associated with a projectile vomiting, visual blurring, and not uh, it's not responding to the regular headache medications basically, and and associated with maybe fits or any neurological deficits. Those are the symptoms and things we should not we should take it seriously, and we should go and consult a doctor and a physician at least.
So curious enough, just wanted to know, like if a headache is recurring in even if after post medication, it can be a cause
Yes,
of tumor,
yes.
right?
So if it is a chronic headache, it's recurring, and by medication it is like resistant to medications, then definitely we should think of something else, and we should try to evaluate the patient properly. Also in the line of brain tumor, definitely yes.
Sir, like how early should somebody reach out to a neurologist in this case, or maybe even to a medicine specialist in this case, if these headaches are recurring?
See, as a neurosurgeon, I will tell ki we have patients. They have been treated under physicians since years,
Oh,
but without being done a scan, and
okay.
they are harboring the brain tumor. They have been treated for migraine. So we find it's not the fault of the physician, neither the fault of the patient. But yes, as a neuro specialist, I would like to stress on few things, that if it is not responding to the basic medication, if it is a chronic one, if it's the headache is very severe, and it is like associated with vomiting, associated with nausea, associated with visual disturbances, any kind of fits, paralysis, walking difficulty, memory deficits, and behavioral changes, yes, definitely one should go for at least a CT scan. If not
Mhm.
MRI, at least a CT scan to see just, yes, the brain is okay, at least grossly okay. But yes, there are few tumors we may miss in a CT scan, but at least a CT scan should be done if we find all these things.
Sir, whenever a patient reaches out to you, like what are the first steps which are taken by a neurosurgeon?
See, if the patient comes to me with all these symptoms, definitely I will try to go for a scan and see. But again, most importantly, before going for a scan, it is important to ask questions to see how the patients and the history of the medications. What are the medications he has taken? How long he has taken? What is the pattern of headache or pattern of weakness, or what are the other associated symptoms? All these are very important, and then and we examine the patients, we examine the eye, we examine the power of the patient, whether there is any neurological deficit, whether there is a behavioral issue, all these things. After that, then if you are very much convinced that yes, it's not a migraine, it's not a basic tension headache, or like we it may be something else, and the patient is suffering since so long, then definitely we recommend for a CT scan or an MRI at least.
So, just wanted to learn what are the common tests normally you people recommend to detect a tumor?
See, if any single test is required, then I would suggest you go for a contrast MRI brain. That would solve all the purpose, most of the purpose, because this is the only test, a contrast MRI brain, that will let you find even if a very small tiny tumor is there inside the brain, which may not be visible to a basic CT scan or a plain MRI. So a contrast MRI brain is very helpful in this condition.
Sir, one more vital question is like, ha- is surgery required in all the cases of brain tumor? Like,
See, as a neurosurgeon, surgery is my duty, or surgery is how I do my things, but not necessarily all brain tumors need surgery. So I can give an example of a pituitary tumor known as prolactinoma.
okay.
When basically the patient comes with, if a female patient comes with irregular periods and galacturia, is unusual milking from the breasts, and like if it is, so those are the certain prolactinomas, they can easily respond to drugs, medicines, and they surprisingly they disappear. If you scan after maybe 1 year or 6 months, you after giving the medication, you won't find the tumor. So 70-80% tumor they subside like this. But yes, few other tumors they respond very nicely to radiation, no need to take out all the tumors. Like lymphomas, they respond very well to chemotherapy. So yes, some tumor we need to take out completely, some tumors we just need to go and take a stereotactic biopsy, just make a hole and go and take out the biopsy, chunk of the biopsy comes out to be a lymphoma, then yes, you go for a simple radiation therapy or a chemotherapy and the patient will be cured. No need to take the brain or the tumor completely out. So it depends. Not all patients require, and also if it is a very small tumor and if the patient is elderly, if only issue is a kind of mild headache or a kind of fits, then we consider giving a anti-seizure medicine or a paracetamol or kind of headache treatment. We know there is there is a tumor, but it's very small tumor. It can be left without any significant side effect or deficits for the patients. Then yes, no need. We can observe. If we know it is not a malignant tumor, we can observe. Yes, we can observe. So it's not this the single rule to go and take out the tumor in brain tumor cases. There are cases we can only wait and watch, we can only observe. And sometimes what happens, if it is an elderly patient with a large tumor and the patient is like we know that after looking at the tumor that it is a high grade tumor and the chances of survival is less, then we also don't go for surgery, rather we want a palliation, rehabilitation, palliation, all those things, because we know that this is a bad tumor, patient is not going to do well, so we won't put the patient in more stress, like
Okay.
surgical stress.
Okay.
So it varies from person to person, but most of the tumors significant size we take out, we try to take out completely. That's
One was very curious question. I'm sure many would be having the same in mind. Like, how safe are these brain surgeries,
brain tumor
tumor
surgery.
surgeries?
See, gone are those days where like brain tumor surgeries were like is kind of rocket science. So yes, it is. It needs precision. It needs patience. It needs long time. It's like lion heart and like all those things. But now the technology has come into the play. Now we have neuro navigation. It's kind of GPS. Now they guide us through a very small corridor towards to the tumor. So
Okay.
no need to go for big cuts, big bone removal. In a very minute, minimal invasive brain tumor surgeries are possible. Now we can map out the tracts, the which are the important part of the brain that is responsible for speech, responsible for hand movements. So we can just avoid those areas and go and take out the tumor. Now it's like we have very high-end microscopies and intraoperative neuromonitoring. We intraoperatively we can see which part is going to be affected, and accordingly we can tailor our surgeries. Now this is the maximum safe resection we can do without giving the patient a morbidity or a paralysis. So tumor surgeries are now they becoming very safe, and most I would say they come out very nicely without much of deficit. So yes, doctor's precision and patience is important, but science and technology have given a lot of advantages and tools that now neurosurgery is very safe.
Sir, normally, like, how long does it take for a person to recover after these kind of surgeries?
See, it also depends on the size of the tumor, on the site of the tumor, and the nature of the tumor. If it is a small tumor on the surface of the brain, we take out easily and discharge the patient in 2 3 days. If it is a big tumor deep inside the brain, surrounded by typical and critical neurovascular structures, then yes, we keep the patients for a longer duration of time. We observe the patients, we see whether there is any deficits. Sometimes what happens, 3 4 days after patients, they become they show some of the deficits. Sometimes post-operative bleedings, they can also occur. So we keep those patients for a longer duration of time in our observation. And if it is a malignant tumor, it is like a cancer, then definitely the morbidity is more. These patients, they require more of rehabilitation, and more of depends on which part of the brain is basically affected. If it is like the brain part affected which is not much of use, like if then it is okay. But sometimes what happens, the speech area is affected, the hand area is affected, the leg area is affected. So in those cases what happens, patient will become kind of neurological deficit, unable to speak, unable to communicate, unable to walk, unable to eat. So those cases definitely we keep the patients for longer duration of time, try to start physiotherapy, rehabilitation as soon as possible, and we directly don't send the patients to home. Rather we try and send them to a physiotherapy center where they can properly undergo a tailored way of speech therapy, occupational therapy, physiotherapy simultaneously, all because these patients they need, depending on the grade of the tumor, the size of the tumor, and also the nature of the tumor.
Here, I feel the necessity to discuss, like, what exactly is the importance of rehabilitation post surgery for these kind of patients?
See, if a patient, suppose I'm telling about a 45-year-old patient, a software engineer,
Okay.
as came to us with a brain tumor. We have operated, and unfortunately, that patient's tumor is in the speech area.
Oh,
Then what happens is unable to speak. Then our job is over. We have taken out the tumor. But what about the patient? He is not able to speak. One side is paralyzed. So we have done only half of the thing. The rest half of the thing is how he goes into the society, how he starts his daily work, how he starts to
right,
communicate, go to job, go to office.
right.
That part is as much important as the surgery. So
Exactly.
that part, how it will be done, it has to be done properly by a physiotherapist, trained physiotherapy center where they work on the speech therapy, they work on the occupational part, how to communicate. These are the things important. Another aspect is in most of the in brain tumor patients, we give steroids for a few more days. Now they has to be tapered down. Now these things cannot be like after we discharge the patient, cannot be directly sent to the home, because these intravenous medications or intra muscular medications directly cannot be tapered to oral medications, and we also cannot keep the patients for a long duration time in hospital. And moreover, patient needs to be ambulatory, needs to be mobilized, needs to be like this occupational therapy has to be done. All these things can only be possible in a physiotherapy setup, proper physiotherapy setup, where simultaneously can be a holistic approach can be done over him, can be made over him, so that he can go as early as possible to the society for his like work, job, and family. So yes, very important part of our job is surgery. After surgery is the job of the physiotherapist.
Sir, basically, as you just mentioned, the very importance of how this physiotherapy works. Normally, what exactly happens when a person who has just undergone a surgery, when he or she comes to a rehab? Like, what course of action that is being undertaken here, this speech therapy or maybe the other therapies? Like, how does that help a person recover? Like, can you highlight on that?
Yes. See, most of the time, what happens after a brain tumor surgery, three, four important things. One is weakness. Patient may sometimes, if before surgery also, patient has come with a kind of weakness. After surgery, sometimes it weakness decreases, or sometimes it remains same. Sometimes it may increase also, depending on the type of the tumor. And it's a variety of tumor, whether it's a cancerous, it is a benign, and all of the things. So what happens after we take out the tumor? Now the brain part is okay, but the patient is still having the weakness and stiffness. Now he is unable to walk, or he is unable to lift his hand, unable to feed himself.
Right.
So what happens here, actually, the physiotherapists, they try to decrease the stiffness, they try to do the range of motion therapies, and like proper mobilization, walking with support, then gait control. These are some of the minute things. So they actually, we overlook those things, but we have seen the patient, they directly go to home, and the difference between the patient go to physiotherapy, go and do have done proper physiotherapy, then come to us. We have seen the patient walking, they come to us walking, but same patient directly going home, not doing any physiotherapy, there is stiffness, they're unable to walk even if they are having all the medications. So definitely the physiotherapy, speech therapy, even music therapy, so many different therapies have come up, and they really help, they really do magic after the brain surgery. So it is highly recommended.
So, with this due course of discussion, can we deduce that after a prop surgery, if a person is following a proper physio regime, as you mentioned, any person or the patient can lead a normal life again?
See, again, I will tell, it's like in my experience, we have seen most of the patients leading a normal life. Most of the patients, if it is a benign tumor. But yes, if it is a malignant tumor, that what happens, even if whatever we do, this tumor progresses. So
Mhm.
in that is a different thing, but still after surgery, most of the malignant tumor also, they lead a very good life for 3 4 years, like that, depending on the type of the tumor and what is the nature and progressive nature, or a the course of the nature of the tumor. So that is a different thing. But in benign tumor, taken out completely, underwent physiotherapy, speech therapy, all those things, those they almost all, they go for a good life, normal, almost near normal life they lead.
Okay. Sir, basically, coming to a very vital question in the sense, I would say, like this is for commoners like us. Like, what is a very important sign, or maybe something which is very important symptom, which in terms of brain health, we should not ignore?
That same, I what I have told, if it is a new onset headache associated with nausea, vomiting, not responding to normal headache medications, mm, these, and associated with seizures, fits like this, or neurological deficits, we should not ignore. We should definitely go to a physician at least and get things checked.
Sir, one more curious question again. Like, does our lifestyle have any kind of effect on these tumors? Like,
Brain tumor. Till now, we have not found anything other than like if we tell this radiation. Yes, other than that, no environmental factors have yet proven scientifically to be a cause for brain tumor. Yes, for other tumors, definitely, like for like oral cancer, like these are some of the very important, like tobacco and all those things. But still now, none of these chemicals or other things have scientifically proven to be a causative agent of brain tumor. But another important thing is that also oral cancer can cause a brain secondary. So any other tumor can cause a brain tumor in a secondary metastasis. So of course we should avoid all those things, because ultimately that can go to the brain from one
Right.
side.
So to put it in a nutshell, any like improper lifestyle certainly will might lead to.
See, improper lifestyle we should not follow. We should always follow the proper healthy lifestyle. Just eat healthy, do a lot of like yoga, pranayam, and joggings, like outdoor activities. Read a lot, listen to music a lot, give rest to the brain, sleep adequately, and mix up with friends, families, so that you need to chill also. You should not be like always stressed. So mental health, yes, definitely needed. Physical health needed. Bad foods, junk foods, we should all avoid. And yeah, that's it. That's how we can keep our brain healthy.
So last but not the least, I would like to like ask you if what message you would like to give to all the people out there who would like to, maybe even are ailing from this tumors, or God forbid might get one in future. So what are the things they should keep in mind? And if at all they are getting one, then what are the early treatment and how they should proceed with these kind of things?
See, if someone is having this kind of symptoms, then first of all, he should go and get consulted with a good neurologist and a neurosurgeon. And if unfortunately comes out to be a tumor, then nothing to be worried. Brain tumor surgeries or treatment is very much available nowadays. Tumors surgeries are very safe. So it's the job of the patient that just to go to a doctor and find out a good doctor nearby, and get it properly consulted. And whatever it's like, don't waste your time. If you find something wrong, don't uh, go to a doctor, talk to a doctor, and whatever he tells, do accordingly. So don't hide your disease, hide your problems from the doctor. You should go to a doctor. And so, and brain tumor surgeries, you should not worry about it. They are very safe nowadays, and it is also curable. Most of the brain tumor, if taken out completely, it's curable. So better to take it out and get to the normal life as soon as possible.
So basically, if somebody acts proactively and takes a proper consultation in the right time, then we can again think of, coming back to a normal life again, right?
Definitely, definitely. It's
Sir,
absolutely curable.
thank you so much for sharing such beautiful piece of information with us. Thank you, sir.
Thank you.
Okay.
Thank you so much.